Few words about adrenergic synapse. Adrenergic synapse. Adrenergic synapse releases norepinephrine. And amino acid, useful amino acid for synthesis of norepinephrine is called tyrosine. So we have sodium tyrosine co-transporter, yeah, or sodium dependent carrier, and tyrosine appears inside the neuron with help of tyrosine hydroxylase. With tyrosine hydroxylase, we have synthesis of DOPA, yeah, and DOPA converted to dopamine. With help of decarboxylase or aromatic amino acid decarboxylase. So dopamine going inside the vesicles, but here we have vesicle-associated monoamine transporter. This vesicle-associated monoamine transporter pumps dopamine inside, and inside we have conversion of dopamine to norepinephrine. And also vesicle-associated monoamine transporter pumps out hydrogen ions. Synthesis of DOPA is a rate-limiting step for adrenergic synapses with tyrosine hydroxylase. So we have medication that's called metyrosine, and this metyrosine blocks tyrosine hydroxylase and prevents synthesis of norepinephrine. Another medication that belongs to sympatholytic group called reserpine, and reserpine blocks vesicle-associated monoamine transporter. In this vesicle we also have proteins, yeah, SNAP protein, this like and in cholinergic synapse. But medications like bretylium and guanethidine block fusion also. So after docking and fusion, we have releasing of norepinephrine into the synaptic cleft, and the norepinephrine interacts with alpha-1, beta-1, beta-2, let's say, and beta-3 receptors, yeah, that present there. And as a result, we have effect. But major mechanism termination of action is reuptake. So norepinephrine molecules reuptake it back, and we have a specific transporter, norepinephrine reuptake transporter. And with help of norepinephrine reuptake transporter, we have reuptake of norepinephrine molecules, and again, these norepinephrine molecules are packed into the vesicles and reused again. What about alpha-2 adrenergic receptors? Alpha-2 adrenergic receptors present presynaptically, and they play important role in negative feedback. This negative feedback is a kind of auto-regulation for synapse, yeah, and norepinephrine acts with alpha-2 adrenergic receptors, and alpha-2 adrenergic receptors, we remember that they coupled with G inhibitory proteins, and they regulate activity of potassium channels. We have opening of potassium channels, we have hyperpolarization, and a less amount of norepinephrine released into the synaptic cleft. What else? What kind of medications we have? Alpha-2 adrenergic agonists. Most likely you heard about them as a clonidine and methyl-dopa. And medications that act on norepinephrine reuptake transporter are cocaine amphetamines, and tricyclic antidepressants. Mechanism of termination of action. First, the reuptake. After that, we have catechol-O-methyl-transferase, and we have monoamine oxidase inside. Catechol-O-methyl-transferase and monoamine oxidase inside.